First of all, you've got a big epidemic on your hands. The risk factor, the hazard for this is ubiquitous. It's everywhere. We have 100% exposure prevalence. That's a remarkable phenomenon. That doesn't happen with infectious disease epidemics. It doesn't happen with the tobacco epidemic or road traffic accidents. So this is an emergency. We say it's a medical emergency. Well, everybody's exposed and everybody is potentially harmed. But certainly we need to bear in mind that people at the extremes of age, that is the young and the old, are the most sensitive receivers. When they take a hit from pollutants, it certainly affects their health to a greater extent than mature adults. Mm-hmm. But I would emphasize that people of all ages, and particularly those who may have some underlying health problem, not necessarily medically diagnosed at the time, but people who have maybe even mild chronic degenerative changes, are going to be very adversely affected by breathing air quality of this nature, day in, day out, over their lifetime. I see what I call a de-professionalization of the Environmental Protection Authority in this town. In the past, the directors were scientists, professional environmental managers, as were the other senior directorate and the middle grade staff of that department. And today that's not the case. The senior directorate are administrative officers mostly. And I think that that department has lost, in that sense, its authority. It's lost its direction in terms of perceiving the paramount importance of the public health impacts of air pollution. And that has led to, I say, lapses in the way in which they drive policy, the way in which they provide independent intelligence to other arms of government, which hopefully would lead to better environmental management. I don't believe that a professional department would have rejected the World Health Organization guidelines. It would have accepted and adopted them and then said, okay, we will now devise a strategy with these guidelines as our targets and implement it on the most expeditious timeline we can possibly achieve. But that's not happening. What's happening instead? Today, we're about, it seems, to adopt some very lax new air quality objectives. In many ways, they're not only fail to improve on the existing AQOs, but they may actually lead to a deterioration of air quality. And they will be enshrined in a piece of legislation. The department doesn't propose that these be reviewed for 5 years. Well, 5 years until we come to a review, the process of the review, then perhaps the deliberation and possible adoption of the results of the review. We may be anywhere between 5 and 10 years before we get any further significant change. In the meantime, we have to live with decision rules which couldn't possibly, predictably will not protect air quality and health. We could certainly go a long way towards fixing it in a relatively short period of time. What we need is political will. We need perception of the risk from a public health viewpoint. And we need, more than anything else, much greater involvement of the health authorities in Hong Kong in this process. At present, because of a government diktat, they are specifically excluded from participating in this aspect of environmental control for health protection, and that needs to change. We need very clear targets, immutable targets, not movable targets, and a timeline which will bring this under control in the shortest possible time to prevent long-term damage to health, illness episodes and premature deaths on a daily basis. Well, the short answer is that we are generating a very large proportion of pollution which is dominant at any one time of the day. For example, Professor Alexis Lau in University of Science and Technology has demonstrated, we think convincingly, that for over 50% of the time, the dominant pollutants at the monitoring stations are Hong Kong species. Traffic signatures, particulates and nitrogen oxides are a very good example of that. Plenty of low-hanging fruit out there that we can tackle straight away next week, which would produce improvements in air quality in the space of 2 or 3 weeks, certainly months, and over the space of 1 or 2 years, a dramatic sea change. Let's start with traffic pollution. We've still got a lot of dirty road vehicles in this town. We have emission standards, but it only applies to new vehicles. So we've, for example, got pre-Euro and Euro 1 vehicles. It's taken us a long time to convert taxi fleets and bus fleets, and we're still not there yet. Commercial road vehicles are out of the frame at the present time. The government's provided funding for these conversions, but it's not mandatory. It's all based on volunteerism. And volunteerism in this area is damaging child health. In fact, the health of everybody. At street level, people in their homes, in their shops, offices, and leisure activities. Certainly, control of the shipping emissions, I would see that as low-hanging fruit because of the extreme toxicity of shipping emissions. These sulfur-rich fuels, bunker fuel with sulfur content up to 4.5%, is extremely toxic. It damages blood vessels, the heart and the lungs of people of all ages. So that must be a very high priority. Let's start with traffic pollution. Hong Kong needs to lead on this. We need to be a role model here. Once we've done that, we're going to be in a much stronger position to help, as well as negotiate, cleaner air quality around the Pearl River Delta.